Good morning. I first wanted to thank you all for being here today. There's a lot of great things happening at Concord right now, and the community beyond our campus wouldn't know about it if it weren't for you. So we appreciate all the work that you do for us, and we're very glad you're here with us today. Let me begin by introducing our panel. Here at the end, we have Bill Allen. He's our Vice President of Admissions. So if you have any questions about the admissions process, he'll be available for you. Dan Fitzpatrick, who's the Vice President of Operations. He's dealt a lot with the funding that we've secured. So if you have any questions about funding, he's your go-to. We have Dr. Michelle Holt. She's the Director of our nursing program. And we have Dr. Kendra Bogus, the President of Concord University, here to speak with you today. Please hold your questions till the end. Dr. Bogus is going to introduce the program, and Michelle's going to tell you more about it. And please get breakfast and coffee on your way out the door today, okay? Thank you all very much.
Well, thank you all for being here. This is a really big day for us, and it's a really happy occasion. We are thrilled to be able to offer a new program in nursing. It's been a long time coming. We learned about this program, and I want to give credit to a number of people in a minute, but we began developing the program about 2 years ago. The major effort was to hire a director, hire our nursing faculty, and to get our facilities into the shape that it needed to be. We also needed many program approvals. So we had internal program approvals that then went to the West Virginia Board of Nursing for approval. That went to the Higher Ed Policy Commission for approval, then to the Higher Learning Commission, which is our accrediting body, for approval. We've gone through all of that since about January of 2022. It has been a race, and we are so thankful for all of the people who worked really hard on this. Our goals for the program: by 2026, we're hoping to have about 300 medical students or nursing students here at Concord, and we'll kind of bunch them together because we're thinking of other related programs. So we are really excited about the opportunities to serve the region. There's currently about a 1,700 nurse shortage in West Virginia, and we want to be one of the places that helps to serve the population in the area and beyond. And so that's one of the goals of the program. We are joining other universities in the state who are also meeting those needs. We are currently working with hospitals, with nursing homes, with doctors' offices, with the emergency medical service people in the area to find placements for our students, which will happen soon. I want to take a minute, if you will give me that time, to thank a number of people. There are many, many people who've been involved with this program development. The first ones are our senators, Senator Shelley Moore Capito and Senator Joe Manchin, who helped us be awarded congressionally directed funding of about $2.45 million. I also want to thank Governor Justice and the West Virginia legislature for funding us with West Virginia Nursing Expansion Grant of about $1.5 million. That's much of what you're going to see today comes through that funding. I also want to thank Chancellor Sarah Tucker and her help there at the Higher Ed Policy Commission, Dr. Cynthia Pursley, who is the the Vice Chancellor for Health Sciences, who's given us great advice, and she's answered a lot of questions and helped us a great deal. Last, but I will say this, definitely not least in my mind, I want to thank the people here on campus who've done so much work to pull this together. Mr. Dan Fitzpatrick, Dr. Huffstetler, Dr. Liptak. They've all written and met and worked really hard with our new Director of Nursing and our nursing staff here. So it's been a joint effort, and I cannot tell you how proud I am of the work that they've done. It's been a marathon, and they've done really well in getting through it. I want to now introduce you to our new Director of Nursing. She is our first Director of Nursing, Dr. Michelle Holt, H-O-L-T. She holds a doctorate from the University of Central Florida with a specialization in nursing executive leadership and management. She joins us after serving as the Associate Dean of Academics at Florida State College of Jacksonville, where she also served as a professor of nursing for 4 years. She's also worked in hospital settings, and if you want more about her credentials, I would urge you to talk with her about them. In the meantime, I would like very much now to introduce to you Dr. Michelle Colt.
Thank you. Thank you, Dr. Vargas, and thank you all for being here today. We have 3 BSN programs. We have our traditional BSN, which is focused on high school students just graduating and students who want to change their majors. We have our BA, BS to BSN, or Bachelor of Science in Nursing program, for students who already hold a baccalaureate degree in a different field. We have also our online RN to BSN program for nurses who want to further their education. So we are a unique program in that we are the only traditional BSN program in this part of the state. We are pleased to be able to offer this to our community, and we feel our curriculum sets us apart. It's rare that a nursing program gets to build a curriculum from the ground up, from scratch, and most universities and colleges have nursing programs attached to their schools, so this is very exciting for all of us. Our focus in our program is on rural health care in West Virginia, which is important to our community, as well as mental health. West Virginia, as everyone is aware, has been hit hard by the opioid crisis, and our focus is going to be on addiction and recovery. Our students will be given the tools and resources needed to successfully pass the RN NCLEX exam while also studying topics that are important and relevant in a 21st century healthcare system. Topics such as nursing trends, legal and ethical issues in healthcare, quality and safety issues in healthcare, as well as pandemics in history. Very relevant, right? Our faculty have combined over 100 years of experience in the healthcare industry. We come from various backgrounds, from acute care to pediatrics to medical surgical, leadership and management. So we have a very diverse background of nursing faculty. Our facilities are state-of-the-art. We have a state-of-the-art simulation center and skills lab. We also are building an anatomage lab. Those are digitized anatomy tables. Most schools have one. We have 3. We also are building a virtual reality immersion room. It's a 4,000 resolution or 4K resolution laser projection onto the walls and the floor. Students will be able to interact with the walls and the floor in an immersive environment where they will be able to see, feel, touch, and smell their environment. Everything from hospital smells to the ocean and meadows, they'll be able to smell those things. It's a great supplement to our existing simulation center. And we will be the first university in West Virginia to have this cutting-edge technology. So we feel that it truly is the wave of the future in simulation. In closing, we are truly grateful for this opportunity and the support that we have received from the community as well as the legislature. So again, thank you all so very much for being here with us today.
Does anyone have any additional questions for our panel?
Oh, sure. So my question's for you. If you could just maybe expand on or just speak to the need for rural health care and to combat opioid addiction in our community and area.
Absolutely. Well, you know, healthcare access in rural communities is an issue. So having our students focus on rural healthcare serves a need in this community. And that's going to be our focus. We want to get out into the community, into areas that people don't have that easy access to healthcare. It's very important to us, and it's very unique in our setting here in Southern West Virginia.
And I also, if you would just want to expand on the funding, I know that it came federally, but also through the governor's office as well.
We have been blessed with friends in high places. There are so many individuals across the state of West Virginia that are interested in seeing our program get off the ground and to be successful. We're especially thankful, as Dr. Bogus mentioned, to the West Virginia senators who have opened the door for funding for creation, not only for operational funding, but for facility development. And we are developing the former Woodell Hall, the ground floor Woodell Hall, into a nursing structure. We'll have additional labs and opportunities over there that would not have been possible without that federal funding. In addition to the $1.5 million that we have received from the state funding, the governor's office has pledged additional funding over another 4-year period, not only for our program, for other programs in the state. So we are expecting some additional support and assistance, not only to get our program more firmly established and moving across time, but also for other programs in the state who are expanding to meet this urgent need. That funding is critical moving forward. We've also been blessed with donors. We have donors who have pledged to support additional laboratories to enhance our current science offerings. So we have pledges, and we have received additional funds for scholarships. We have over $1 million pledged in scholarships currently from a single source. We have another $250,000 in scholarship funding available. We have pledges from our healthcare partners to provide scholarships for nursing students. So this is a Southern West Virginia project fully, completely, and we welcome all the support and encouragement that's out there. We appreciate what we have received. We're going to continue to ask and continue to press to expand this, and not only nursing, but other programs in the future to meet the needs of our region.
And all the scholarships you mentioned were for new programs.
All the scholarships were for new programs.
Absolutely. That is correct.
That's awesome. Thank you.
And then, this is a general question for whoever, but how do you feel that this nursing program will impact the students and the university's growth in general?
You want to answer that, Bill?
Well, we feel, as Kendra mentioned, President Bogus mentioned, we're shooting for 300 nursing students, which if you look at our offerings, most of those students would not have been here had we not had nursing, had we not brought nursing to the fold. So I think it's going to help with overall enrollment for the institution, of course. And I think the nursing faculty that we have is absolutely incredible, the amount of experience we can already bring to the table. So I think that will attract new students to Concord.
Does anyone have any additional questions? Okay. At this time, we'll give the media a second to pack up, and they're going to take you downstairs and show you some of the labs that are already set up. We have a
So
lot
it's
of-
at the bottom of the fine arts building.
Correct. So we'll take it downstairs. There is some technology that Michelle mentioned that we haven't, we've got it here, but it's not up yet. In that press release, the digital copy that you get, there are links so that you can review it and look at it and see what it will be when it gets here. So if she mentions things like that, you've got access to the press release, okay? Thank you all so much.
Thank you.
Thank you.
Thank you all so much for being here.